Carol Marak at carolmarak.com. Welcome to Solo and Smart, my YouTube channel. And I want to tell you about a toolkit which is called the Healthcare Advanced Planning. And it is put together by the American Bar Association. And it's for the purpose for those of you who are thinking of making a healthcare advance directive, such as a living will or durable power of attorney for healthcare. Or you may already have one, but you're aware that just having a written advance directive by itself does not ensure that your wishes will be understood and respected. So there are 8 tools in this toolkit. And I'm going to put the link below in the description. Take a look at it. It's free to download. And please put it to good use for yourself. And the 8 tools in this kit is how to select your healthcare agent or proxy, goals near the end of life, how do you weigh the odds of survival, personal priorities and spiritual values in making medical decisions, after-death decisions to think about, right now, conversation scripts, getting past the resistance, the proxy quiz for family or physician, and what do you do after signing your healthcare advance directives. And just remember, good advance planning for healthcare decisions is a continuing conversation about your values, priorities, and even the meaning of your life and the quality that you want it to embrace. So this toolkit has a variety of self-help worksheets, suggestions, and resources. And for the first one, for example, how to select your healthcare agent or proxy. So when you decide to pick someone to speak for you in a medical crisis, there are several things to think about, and this tool will help you decide who is the best person for that job. And by the way, it may be a group of individuals, not just one. So take a look at it. The second is, so it's a very lengthy toolkit, and it really gives you clear guidelines and checklist. So the number 2 tool is goals near the end of life. And that worksheet helps you think about situations in which your goals of care would change. Number 3, how do you weigh the odds of survival? Because people evaluate the pros and cons of medical treatments in very personal ways. And this explains why some people may choose a treatment and while others may reject it. The tool number 4 is personal priorities and spiritual values in making medical decisions. And there are spiritual beliefs that affect our medical decisions. So this is especially true at the end of life with regard to the use of life-sustaining treatments. And then the tool number 5 is after-death decisions to think about right now. After the death of a loved one, family and friends, or maybe even yourself, are often left with some tough decisions. And you can help ease the pain and the burden by making your wishes about burial, autopsy, and organ donations clear in advance for your family and loved ones. Number 6 is why talk about medical preferences in advance? Because communication is the single most important step in healthcare planning. Talk about your wishes with the people who may be called upon to speak or decide for you. And then tool number 7 is the proxy quiz. So how does your family, proxy, or doctor know your healthcare wishes? And this short test can give you some sense of how well you have communicated your wishes to them. And then number 8, which is the last tool, is what to do after signing your healthcare advance directive. Advanced care planning for healthcare is always a work in progress. That's because circumstances change and lives change. And your values and priorities may change as well. So remember, the world looks different when you're horizontal rather than vertical. That's a good way to end this video. So head down to the description of this video where you can download the American Bar Association Toolkit for Healthcare Advanced Planning. Well, thank you for joining me. Please circle back in the next day or so. Subscribe to this channel, give it a like or a thumbs up, and share this video with a friend who may be planning their own healthcare advance directives. Thank you.